to Wings LifeWise Family Workshops. We know there are many people that are streetwise, but we want you to be LifeWise, and that's why we came up with this name. And this is one workshop out of 8 that are part of a series. We're very thankful that you're here with us today. My name is Ann Edenfield-Sweet. I'm the Executive Director of Wings for Life International, where we want to give you wings to fly for the rest of your life. And so today we've got some expert speakers that are going to help us with this and are going to help us understand more about public housing and all the options that are available here in the state of New Mexico. So I'm very excited that we've got Lisa Howley with us today. She's the Supportive Housing Program Manager, and she kind of oversees all of the funding that the state has regarding housing. So Lisa, why don't you tell us all about your program?
Hi, everyone. So I'm happy to be here. Again, my name is Lisa Howley, and I'm the Supportive Housing Program Manager for the Behavioral Health Services Division under the Human Services Department. And what I'll be talking about today is a couple of the programs that are supported by state general funds. There are several programs statewide that support individuals experiencing homelessness. However, what I oversee are the programs that state general fund support. And one of those programs is Linkages. I'll share my screen. I hope you're able to see that. So Linkages is one of our priority programs. It is a permanent supportive housing program. So what are the learning objectives for this program? What is supportive housing? An overview of the Linkages program. Who are the Linkages program partner agencies? And Linkages and the Supportive Housing Medicaid Code. This program is supported by Medicaid as well. So what is supportive housing? Supportive housing is subsidized rental housing affordable to the lowest levels of income, below 30% area median income. Supportive housing is linked with supportive services to support tenancy and address other needs. It's also an evidence-based practice for recovery and resiliency. What are the basic principles of supportive housing? Support services for clients are individually tailored, flexible, and voluntary. They're not a condition for ongoing tenancy. Support services should promote independent living and focus on helping tenants find, get, and keep their housing. The tenants hold their own lease. This is important. It's not a condition of programming that the provider holds a lease for these tenants. Housing is not subject to time limitations, only the lease time requirements. Leases are renewable if compliance with the lease and property rules are maintained. And to ensure tenants remain housed, ongoing and regular communication must occur between service providers, property managers, and tenants to resolve any conflicts. So what is Linkages? Linkages, let me start that Linkages started in 2007, and it started with an initial allocation of $300,000 of state general funds allocated by the legislature. This program began in 3 sites, Santa Fe, Albuquerque, and Silver City. Deming. This program is in collaboration with the New Mexico Mortgage Finance Authority and the Human Services BHSD Department. So how it works is BHSD, we contract with support service providers, as well as we contract with the New Mexico Mortgage Finance Authority, who self-contracts with housing administrators. This program is the highest funded program of our supportive housing budget. To give you an example of how much progress this program has made, as I mentioned, this program started with a $300,000 legislative state allocation, and currently we're at 3.8 million. In fiscal year 21, we received an increase of $4 million to the supportive housing budget, and a lot of that money went to the Linkages program. I went over some of this. Who are the providers of Linkages? And I'll explain exactly what this program is. I'm sorry. So we have housing administrators in Albuquerque, Silver City. We have 8 providers now. Albuquerque, Silver City, Clovis, Santa Fe, Las Cruces, Farmington, Taos, and Gallup. And I won't read them off to you, but we have housing administrators and support service providers that work together for this program. And you can contact me if you need information about any of these providers. Who does Linkages serve? Linkages serves individuals that meet the eligibility criteria of a diagnosis of severe mental illness, SMI, which has resulted in functional impairment, also co-occurring, individuals that are homeless or precariously housed, and extremely low income level. The definition of homeless or precariously housed is not the same definition as the federally funded programs. The homeless or precariously housed definition includes people who are living in a place not meant for human habitation, in emergency shelter, in transitional housing, or are exiting an institution where they temporarily reside for up to 90 days and were in a shelter or place not meant for human habitation prior to entering that institution. Second, people who are losing their primary nighttime residence, which may include a motel or a hotel or a doubled up situation within 14 days, and resources or support networks to remain in that housing. Specific documentation may be required for this category. Third, families with children or unaccompanied youth who are unstably housed and likely to continue in that state. This category applies to families with children or unaccompanied youth who have had a lease or ownership interest in housing until the last 60 or more days, have had 2 or more moves in the last 60 days, and who are likely to continue to be unstably housed because of a disability or multiple barriers to employment. So how does it work? The support service agency will look within their client. They will do client inreach or outreach. So individuals that may not be a client of the support service agencies that I listed, they can come to the support service agency. For example, we have LifeLink in Santa Fe. In Albuquerque, we have First Nations, Albuquerque Healthcare for the Homeless, and HopeWorks. If an individual meets eligibility criteria, they'll complete an application with the support service provider. That support service provider will verify their homeless situation, their SMI disability. They'll do a preliminary check of their income. They'll sign all the forms necessary for Linkages programming to include a participation agreement, conduct orientation. And that service provider will send all of that information to what's called the housing administrator. Those are the subcontractors of the New Mexico Mortgage Finance Authority. The New Mexico Mortgage Finance Authority contracts with 6 different housing administrators statewide, and those 6 housing administrators cover the 8 sites that I had mentioned prior. The housing administrator will review that application, make sure the individual meets income criteria. If the individual has a criminal history, there's only limitations to eligibility if the individual is on the lifetime sex offender registry, as well as if they have a conviction for distribution of substances. Those are the two that we follow. The public housing authority when it comes to that eligibility criminal history criteria. So the housing administrator will review all of the information When the tenant identifies a housing location, that housing administrator will do a housing quality standards check. And if it passes, this individual can use the voucher to pay for rent. That voucher will cover all of that individual's rent, except for 30% of their income. If that individual is not employed, then that voucher will cover 100% of their rent. So again, this is just going over the steps. There's a support service provider it starts with, identifies and screens for eligibility criteria, sends the information to a housing administrator, that should say administrator, who issues a rental assistance voucher, and it goes back, the process goes back to a support service provider who will work with that client on securing the housing, moving in, work on eviction prevention, provide services. And what's really important is they'll conduct a monthly house visit to ensure that things are going well. These support service providers do really well with these tenants, and this is one of the most effective, efficient programs that we have. So if you have any further questions, you can always contact me. My name is Lisa Howley again. lisa.howley@state.nm.us is my email address. Lastly, just to give you an idea of how Linkages serves the state, with the additional funding that we got for fiscal year 21, we were projecting to serve 338 clients with vouchers. The monthly rate, that doesn't apply. That's some Medicaid information that I didn't go over. But there are currently over 300 vouchers utilized in New Mexico. There are other programs that the state covers. We have the Move-in Assistance Eviction Prevention Program, which is separate from Linkages, but we have 7 providers in the state that cover all of the counties in the state. I can get a list to you of those providers, and that is a rental assistance program where individuals who meet eligibility criteria, who are homeless or precariously housed, have a serious mental illness disorder, and are at risk of homelessness, they can receive a grant of up to $1,000 to help them with utilities, rent, late fees, and so forth. The providers for move-in assistance eviction prevention include the LifeLink in Santa Fe. We have First Nations in Albuquerque, HopeWorks in Albuquerque, Via del Sol, but they're transitioning to team builders. We also have mental health resources in Clovis. Sorry, I'm trying to pull up at the same time while I'm talking the list of providers.
Lisa, thank you so much, because what we'll do is we'll put that list on the website to go along with this. So anyone that is listening will be able to pull up that list of resources, and anything that any of our speakers are talking about today, they can give us materials that will be available on our website and also available through our Wings LifeWise family workshops. So thanks so much for being with us, and we'll hear from you at the end. Next, we're going to go to Trina Wheeler. She is with the Presbyterian Health Plan.
You're on mute. You're on mute, Trina.
Trina, you need to unmute yourself, please.
Thank you. Hi, everybody. My name is Trina Wheeler. I'm the Housing Program Manager at Presbyterian Health Plan. Presbyterian, like all 3 MCOs, provides a housing program to assist people experiencing homelessness or at risk of homelessness with finding housing resources. And if I can get the slideshow to work. There we go. So the way Presbyterian works, the housing program is a requirement of Centennial Care 2.0. Prior to working with Centennial Care, I worked with another MCO who isn't in New Mexico any longer providing this service. And I did a lot of research on housing to learn what works and what doesn't. And when I came over to Presbyterian, based on that research, this housing program started up and follows best practices in line with the research. And basically, you have a care team that's generally headed by your care coordinator, but it might also include a community health worker, a certified peer support specialist, your providers. Some people have multiple providers, or a primary care provider. And the care coordinator leading that team assists with connecting the member to resources. Those resources are many and varied and include housing, but they also include things like traditional medicine, personal care services, and wellness classes. Once a referral is made to the housing program, we start the process of collecting data. We need to know as much as possible about the person being referred. What's their situation? Are they homeless? Are they in the process of an eviction, or for some other reason at imminent risk of becoming homeless? Also, we research their community, if they're in frontier land, rural New Mexico, or the city. There are several city settings: Las Cruces, Farmington, Gallup, Santa Fe, etc. We try to find the resources in that community that would assist them. If they live in an area where there are few or no resources, then we reach out to the next nearest community that does have resources. Once we have found the resources that might address that person's concerns, then we consult with the care coordinator or whichever member of the care team is leading the housing search and the member, letting them know which services are available to them, what the eligibility criteria are, how to access that, how to apply. And then we're available for consultation as they go through their search. Generally, like I said, that search is led by the care coordinator or some other member of their team. We serve the entire state, so we don't do one-on-one care coordination with the member who's searching for housing. We let their care team do that. We try to find as many resources as possible and often list them in order from those that are most accessible, most immediately accessible, to those that probably have a wait list. And those things that are most immediately accessible generally include doubling up with family or friends, shelters, boarding homes, rapid rehousing programs, and so on. Solutions that take time might include subsidized rentals, Section 8 housing, permanent supportive housing, or housing programs for specific populations, like people with addiction issues might go into a long-term rehab, that sort of thing. There are a lot of different kinds of housing resources. It's sometimes a full-time job just to keep track of them. So we have programs that include housing, and this is by no means comprehensive. This is just a sampling. That might include residential treatment programs, permanent supportive housing, halfway houses, Oxford houses, which are homes for people who are working toward recovery or sobriety. Then we have no and low cost housing, things like the subsidized rentals that Lisa mentioned, affordable rentals. We can search for rentals in your price range that include utilities, allow pets, whatever the circumstances. And of course, Section 8, there are housing authorities all over the state covering most of the state. Private market affordable housing. Those are the private rentals that we search for in your price range. And listed here are some of those search engines that we use. Financial assistance, things like rental assistance program. Sometimes the difference between being able to pay your rent and not is having assistance with food or utilities. So we'll search for that too. If you're eligible for temporary aid to needy families, general assistance, SSI or SSDI, we'll assist with that as well. SOAR is a program that assists people with a disability who are literally homeless, applying for Social Security. We assist with SOAR at Presbyterian as well. Finally, if you need housing or assistance with housing, you need to connect with your care coordinator. So simply asking your care coordinator for a housing referral should do it. If you don't have a care coordinator, you can call the customer service phone number on the back of your Presbyterian ID card or one of these numbers. It'll get you to the same place and ask for care coordination. Finally, if you don't have the card, you're not going to be looking at this slide. Just Google Presbyterian customer service and it'll give you the number. If you just have questions about housing or Presbyterian's housing program, you can email me directly. My email is on this presentation and I'll be happy to answer your questions. So that's it for me for now. Thank you very much.
Wow, thank you so much. I'm learning so much here, and I'm sure the listeners will be learning a lot too. Well, next, we're going to hear from Judy Padwell. She is with Blue Cross Blue Shield. And Judy, if you would like to share about what your program has to offer.
Yes, I would. Good morning. My name is Judy Madwell. I am the Supportive Housing Specialist at Blue Cross Blue Shield. And I wanted to talk to you a little bit today about a specific project that we have here at Blue Cross Blue Shield. And then also to give you some ideas about how our supportive housing program works at Blue Cross Blue Shield. So the first thing I want to talk to you about is value-added services. So each of the MCOs has a little bit of their grant funding that can be used for what is called a value-added service. And a value-added service is what we try to do with those is to improve the quality and health outcomes of our members and or reduce the costs that we are paying out for our members by reducing the need for more expensive care. And one way that we're doing that is through our Transitional Living Services program. So Transitional Living is a very short-term kind of support that can be given to our members. And what we're doing with them is we're working on preventing higher levels of care, such as going to an emergency room or going into a hospital. And we feel like if we are able to utilize transitional living, short-term supportive housing, that we're going to be able to help our members kind of get their feet on the ground so they're not having to go into a higher level of care. So here in New Mexico, we've been working to set up partnerships with 5 different agencies for doing this transitional living. And see, I've got this abbreviation here, TLSVAS. That's Transitional Living Services Value Added Service. And here are our partner agencies that we're working with. In Albuquerque, we're working with Endorphin Power Company and Turning Point. Both of these are agencies that help members who are working on recovering from drug and alcohol use, and they are sober living facilities. They have some programming that goes with the sober living, such as an intensive outpatient program. We were working with Zia Recovery in Las Cruces, And that's another sober living program with intensive outpatient services. We're working with Loving Hands, and they're in Albuquerque and Rio Rancho. And they're more for people who aren't necessarily working on drug and alcohol conditions, but they are needing to live somewhere for a short-term basis and stay out of a higher level of care that they might need if they didn't get this service. And we're also working with SPIN. It's an agency in Silver City and Deming. It stands for Supporting People in Need. And they work with people in the Silver City and Deming areas. And they would be also similar to Loving Hands, where it's a boarding home. And they're working on keeping people at a level of care where they can get the services they need, such as behavioral health services, transportation to their physicians, and then just the support of being in a home with other people. And so, as you can see, we're working on getting this service to as many areas in New Mexico as we can. And so we're right now Albuquerque Metro and Las Cruces and Deming and Silver City. And then, in addition to these 5 locations in the state that I mentioned as the Transitional Living Value-Added Service, last year in 2020, we purchased 2 medical respite beds. One of those is at the Albuquerque Opportunity Center. It's a center for men. And the other is at Barrett House, which is a center for women. And in both of these settings, this would be a medical step-down program. So if someone had been in a hospital or maybe in a skilled nursing facility, and they still have some of their medical needs that need to be addressed, and we don't want the people to go back on the street or into a substandard way of living. And so we will support people for a short while in one of these places. All of these are short-term services. The transitional living, the 5 in the top half of this slide, are for people who are, we might approve 30 days at a time for that. And then for the medical respite beds, we usually approve 2 weeks at a time for those. And then we withdraw that care as soon as we feel like they can go back to the other level of care that they were at or the other living situation they were at. And so then I just wanted to talk to you a little bit about how Blue Cross Blue Shield works with regard to getting people into the supportive housing roles that they need. In my role, I'm a little bit in the background, so I'm a behind the scenes person. I don't see people very often. But I work in the background with all of the supportive care, the care coordination teams. So care coordination team can consist of a recovery support associate, a community health worker. It can be a transition of care coordinator if it's someone who is transitioning from, say, a hospital or a nursing facility into another level of care, or it can be the care coordinator. In order to access all of these services, you could start by calling our customer service number. It's right here, 1-866-689-1523, and you ask for support. You just say, I need care coordination, or you can say, I need a recovery support associate or a community health worker, and I need to work on housing. So that gives the customer care people the information they need to get the ball rolling. And then once the person, so the customer service will get someone assigned for the member, and then I will be working with whoever is assigned to the person. And once again, here is our number for customer service. That would be your entry point if you're needing this type of service, if you're a Blue Cross member, and or if you have a family member who is needing transitional housing. This concludes my presentation, and I want to thank you for this opportunity today.
Thank you so much, Judy. Wow. Every speaker, I'm learning all these new things here. And next, we're going to hear from Trina Lopez. She is with Western Sky. So welcome, Trina.
Thank you. Thank you, Anne. So hello, everyone. My name is Trina Lopez, and I am the Housing Management Specialist at Western Sky Community Care, and I've enjoyed the opportunity of this position for the last 2.5 years. My career in the housing industry has now spanned for about 18 years, which including assisting the homeless and the behavioral health population for about 14 years. So during this time, I've completed continuing education, attended seminars and workshops, and I've been awarded many certificates for customer service, direct care, and training certifications, as well as housing inspection. And I take great pleasure in being the first New Mexico's first housing specialist in the Housing First model housing program. And in addition, I've also passed the training as a certified peer specialist. I currently serve on the board of directors for New Mexico Coalition to End Homelessness, as well as a sitting member for other housing groups, several other housing groups. And in addition to housing training, I also have a Bachelor of Science degree in Business Administration, and I look forward to continuing my career at Western Sky by compassionately assisting the most vulnerable and by giving of my knowledge and experience. So I'm going to share my screen now. I'm going to show you my PowerPoints. I'm hoping that you can see my PowerPoint. If somebody can just give me a heads up.
Oh, I can't see it yet. So try again.
Okay. Okay.
There you go.
All right. So Western Sky Community Care, we also have permanent supportive housing services. And who I am and who we are. So like I already introduced myself, I am the Housing Management Specialist. Since Western Sky Community Care is a long name, I'm also going to abbreviate it at times to WSCC. So we are one of the three New Mexico Medicaid MCOs, as we've already determined it. I work with the Behavioral Health Liaison team. Just to let you know, though, however, those who are in need of housing services, they don't necessarily have to have a behavioral health diagnosis. So this is my information. This is the manager and the director's information. The customer care service is 844-543-8996. So my role is that referrals to the housing program, we receive them internally from care coordination, from peer support, from community health workers, transitions of care, and as well as other staff members. So following the receipt of the housing management specialist, I conduct a housing assessment with the member themselves or the member's family, and it includes evaluating their situation, their needs, and their financial resources. We do not, at WSCC, we do not have housing vouchers. Therefore, one of our strategies is to reach out to several housing providers, both within the coordinated assessment system and the general system, which includes the Linkages voucher that Lisa spoke of earlier. So following the housing assessment, access some of the resources for them. The Linkages voucher providers, I'm throughout the state, because I'm also the housing specialist for Western Sky throughout the state of New Mexico. I also reach out to coordinated assessment housing providers. I will also help them complete the assessment if they haven't already done so and submit it to the New Mexico Coalition to End Homelessness. Some of the programs I also access for the members or help the members reach out to is the Hope Works Section 811 Special Needs. I also help, if the members already have a housing voucher, say they were recently issued a Section 8 voucher or a Linkages voucher, I also help them locate a landlord that will work with some of the challenges that the members may face. Such as a criminal background or evictions. I am familiar with many landlords that will work with the various population needs. So some of the other resources that I've already successfully housed some of our members through, I have referred them to Section 8, and as well as I help them reach out to Family Promise, Serenum, Stillbridge, Heading Home Shelters, Barrett House, and St. Elizabeth Shelters, the Women's Coalition, the Lifelink, the Oxford House, and those are just to name of a few. I also reach out to other in-state providers by utilizing the MFA Housing Services Guidebook, as well as the Albuquerque Resources Guide. Sometimes I still respect the privacy policy that Western Sky has, which includes not saying any names or date of birth. So sometimes I will also reach out to my peers, the other MCO housing specialists, just kind of say, hey, do you know if there's any resources? I have a member that this is the situation, and it seems to help. They are wonderful. The other two housing specialists are just wonderful. They will either say yay or nay, and when they say yay, it's wonderful. There's providers out there that I would think I would have already heard of them, but everything is new. We're always learning the situation, so they refer me to a provider that I hadn't heard of, and it's wonderful because then I have somebody else to reach out to in the future. So the additional roles, that I have is I attend various housing workshops, as mentioned. Sorry. I refresher courses. I'm always wanting to learn, always trying to refresh what I've learned. I attend meetings and webinars. I'm a member of the collaborative housing groups, which I've already mentioned, and this is just a few that I am currently a member of, including the housing leadership group that Lisa presents to us. And so right now, I've already mentioned that I am serving on the New Mexico Coalition to End Homelessness, the board of directors. I already mentioned I collaborate closely with the other MCO housing specialists. Also, one other thing that I'd like to mention is we like to get together. Right now, we're doing it through Zoom, but each month, we like to get together just to do a little bit of brainstorming, a little bit of communicating. We just like to talk to one another, and so we get together once a month. We try to anyway, and sometimes one of us will invite a member from another agency to discuss what their housing and their services are. So this kind of helps us as well. We join forces in navigating the housing industry. It's a big industry, but it takes a lot of navigation to find the right program for our members. I do attend the annual lobby day at the Santa Fe Legislature Roundhouse. And so we too also have the value added services. So here's the different programs that are included in the value added services. And this right here is some of the other programs that Western Sky has, besides the running a medicated and medical, as well as insurance. We also have other programs within the insurance that Medicaid allows us to offer to the members. We do have Heading Home respite beds as well, with the Heading Home program. So again, this is the end of my presentation. I want to thank everyone for this opportunity, and I look forward to working with everyone and talking to everyone.
Thank you so much, Trina. Well, I'm
You're
going to invite
welcome.
everybody to come back so we can see everyone again. And hopefully, if you are listening to this and you need housing help, you have now heard from all of these wonderful women who have dedicated their lives really to helping people to find good, safe, wonderful housing for them and their families. So is there anything that you want to share, anything that you say, oh my gosh, we just need the people of New Mexico to know about anything particular? Anything anybody wants to share?
The two programs that I went over, the move-in assistance, eviction prevention program, and linkages are just two of several that the state oversees and funds. So there are different programs available. Just reach out and can definitely give a comprehensive list of what's available and the providers statewide that are delivering those services.
Well, I really appreciate it. And it's wonderful to have somebody from the state here, as well as the three major providers for our state. And so we will include also on our website and through the LifeWise workshop program, all kinds of resources. So these ladies will be sending me any handouts, anything that they want you to be able to have access to, phone numbers, descriptions about the various programs, and ways that you can help. So thanks so much for being with us here